So, okay, let's take these from the top, right? Um, uh, Arterial blood has a pH which physiologically corresponds to 7.4. If this value falls under this homeostatic value, physiological value, we have acidosis, blood acidosis. And this may be due to low levels of bicarbonate or to high partial pressures of CO2. In the first case, we talk about metabolic acidosis, and in the second case, we talk about respiratory acidosis. Metabolic acidosis will lead to a respiratory compensation. So the low levels of bicarbonate will try to be compensated by hyperventilating and increase the levels of excreted CO2. While the high levels of partial pressure of CO2 will lead to renal compensation by increased loss of protons. Alkalosis occurs when the pH raises above 7.4, so that may be due to high levels, high concentrations of bicarbonate, also known as metabolic alkalosis, or low partial pressures of CO2, also known as respiratory alkalosis. In the case of metabolic alkalosis, again, we will have respiratory compensation. In case of respiratory alkalosis, we will have renal compensation. So let's take metabolic acidosis, right? A decrease of pH due to a reduction in the base levels, so in the bicarbonate concentrations in the blood. The loss of bicarbonate may be due to different factors, for example, diarrhea or type 2 renal tubular acidosis, which consists in a failure to reabsorb bicarbonate at the proximal convoluted tubule level, or gain of acid, so increased concentrations of protons due, for example, to diabetic ketoacidosis. Okay, so in diabetes, the body tries to use other sources of energies other than glucose in hypoglycemia, and that leads, for example, like protein or fatty acids, and that can lead to the accumulation of acid, such as lactic acid buildup. Lactic acid is, somehow related to the pyruvate. Is the form of pyruvate which can cross the plasma membrane, and is the acid which is produced by your muscles when you're under strong exercise, and they have to work in low oxygen levels because your respiration, your ventilation is not enough. Okay, to your ventilation, your cardiovascular system cannot supply enough oxygen to the muscles for the kind of work that they're carrying out, right? So when the lactate acid builds up, you have that phenomenon which is known among sports persons. I didn't fall for it. Which is called hitting the wall. Literally, your muscles cease to avoid you dying, basically, right? That's when protons enter the cells, causing hyperkalemia, which is increased potassium levels in the blood. And the increased potassium leads to the increased excitability of plasma membranes, leading to contraction of muscle. Finally, the inability to excrete acid in forms of protons, so for example, due to renal failure. The metabolic acidosis compensation consists in increasing CO2 loss via respiration, via increased ventilation. And that helps to drive the equilibrium to the left, reducing the concentrations of protons and trying to prevent acidosis. So, for example, if you take just normal exercise, okay, when you're jogging or running fast, you hyperventilate to get rid of CO2 and prevent acidosis of the blood. Of course, metabolic acidosis is not a physiological condition, so we can't talk about metabolic acidosis for people exercising. That's a perfectly physiological function. But if we take the example of Jennifer Smith, age 14, and she has been brought to the A&E. Jennifer has been eating a lot, but she's been losing weight. She has been thirsty, and because of that, she's been drinking large amounts of water, and she's been going to the bathroom frequently. Jennifer is struggling to wake up. Her skin is warm, dry, and flushed, and she breathes deeply and rapidly. Why is she breathing deeply and rapidly? Because the respiratory system is trying to compensate the metabolic acidosis by removing CO2. Jennifer may be having type 1 diabetes, which is what may be causing her metabolic acidosis. So the metabolic acidosis caused by diabetic ketoacidosis occur in all kinds of diabetes mellitus. In case of Jennifer, we're talking about type 1 diabetes mellitus. And the symptoms of ketoacidosis are central nervous system depression, dysrhythmias of the heart, and decreased strength of cardiac output and the contractility in general of the cardiac muscle. When the plasma pH reaches 6.9, the brain stem stops working and the person dies. Because the brain stem regulates autonomic functions, including the breathing function, thanks to the pneumotaxic and apneustic centers. Jennifer is suffering from ketoacidosis caused by type 1 diabetes. And what might help their symptoms? That would be intravenous insulin to decrease the glycemia. So in respiratory acidosis, we have failure to remove CO2. The buildup of CO2 caused by hypoventilation can be caused by a damage to the respiratory center in the brainstem, or this damage or this depression of the respiratory center may be even drug-induced. For example, heroin causes respiratory depression. Disorders of respiratory muscles due, for example, to infection by the poliovirus or due to multiple sclerosis. Disorders of gas exchange due, for example, to heavy smoking, chronic obstructive pulmonary disease, pneumonia, emphysema, all those conditions which affect the brain parenchyma and fill up the alveoli with substances which obstacle the exchange of gas or reduce the overall alveoli surface due to direct damage. So overall, decreasing the exchange of CO2 between the blood and the alveoli. So the decreased excretion of CO2 due to respiratory impairment then is compensated at the renal system by increasing the excretion of protons, both as titratable acids such as phosphoric acid, but also ammonium ion, and by increased bicarbonate synthesis and reabsorption. So in the respiratory acidosis compensation, we increase the loss of protons and we increase the levels of reabsorbed bicarbonate. So increasing bicarbonate will buffer the protons, preventing acidosis, but also losing protons via the urine by making the urine more acid will prevent acidosis, or it will help prevent acidosis. So, for example, heavy smokers who develop emphysema. So heavy smokers disintegrate the alveolar walls over time, okay? Because the cigarette smoke can destroy the alveolar walls over time, right? So destroying the alveolar walls results in large air spaces within the lungs, which remain filled with gases during the expiration. So this condition reduces the surface area, which is useful for the exchange of gases between the blood and the alveoli. And so the effective surface, which allows the exchange of oxygen and CO2 between the blood and the alveoli. So because of emphysema, the body will have more difficulty to remove acid from the blood, because it will struggle to remove CO2 via ventilation. So respiratory acidosis can cause headache, cardiac dysrhythmias, blurred vision, dizziness, disorientation, and lethargy. And there's really no cure for emphysema once it's set up, once it's onset. But there's a wonderful, easy way to prevent it, which is to stop smoking. So metabolic alkalosis, on the other hand, is caused by increased concentrations of bases in the blood, specifically by increased levels of bicarbonate. So increased levels of bicarbonate can be caused by some antacid drugs or diuretic drugs, which enhance the reabsorption of bicarbonate, but also by loss of acid. So, for example, vomiting can cause the loss of a lot of acid, or excess of aldosterone, which increases the proton secretion in the distal tubes. And finally, last but not least, diuretic drugs, which enhance proton secretion. Metabolic alkalosis can lead to respiratory compensation by reducing the CO2 loss via hypoventilation, so reduced ventilation. Metabolic alkalosis compensation moves the equilibrium to the right, okay? Because by reducing the level of CO2, that will will decrease the levels of bicarbonate, and will increase also the levels of protons to prevent alkalosis. Okay. Because if we reduce the amount of CO2 which we excrete, then we increase the levels of CO2 that we retain in the body, and that will move the equilibrium to the right with increased production of protons. So, for example, Jose has contracted stomach flu and is experiencing metabolic alkalosis due to vomiting, and this can cause severe alkalosis. Severe alkalosis can cause central nervous system depression, confusion, lethargy, and finally coma. The death occurs when the plasma pH reaches the level of 7.8 and above. So the respiratory alkalosis, on the other hand, due to hyperventilation, that is to say, to increase the CO2 removal, may be caused by different factors. For example, the stimulation of the respiratory centers, such as in neurological disorders or cancers or stroke, or panic attacks can lead to hyperventilation. Secondary effects of meningitis or fever or altitude sickness, and that will lead to renal compensation by decreasing the excretion of protons as titratable acid and ammonium ion, and decreasing the bicarbonate levels of synthesis and reabsorption. So the decreased loss of protons and the decreased levels of bicarbonate will move the equilibrium towards the right once again, increasing the levels of protons. Okay, so decreasing proton loss will prevent alkalosis, but also decreasing the levels of bicarbonate will increase the levels of protons and prevent alkalosis. So respiratory alkalosis can be caused by severe anxiety. I actually experienced this myself. Respiratory alkalosis due to hyperventilation can lead to sweating, numbness, and tingling in fingers and around the mouth. And it can go beyond that and actually create induced paresthesia, which is the involuntary contraction of the muscles of the limbs and of the mouth, giving a very uncomfortable sensation of paralysis. Of course, confusion, dizziness, cerebral vasoconstriction, and it can go up and cause seizures and coma. So, in order to reduce the symptoms of anxiety, Sally can decide to relax, or if she cannot relax, because sometimes you just can't relax when people tell you to relax, to prevent the effects of alkalosis induced by hyperventilation, she can hyperventilate into a bag and breathe back her CO2 to increase the levels of acidity in her blood. So renal compensation may take days when it's caused by respiratory alkalosis. So while severe anxiety is often, a condition which leads to acute effects. So in case of Sally's alkalosis, the condition is short-lived, and so the renal compensation in this case may very well not occur. So Sally will actually probably return to acid-base homeostasis as soon as her visit to the dentist is over and her respiratory rate goes back to physiological levels. Or as I said, if it's very severe, she can breathe into a bag. Okay, so we're close to the end, and I would like to go through some of the key points that we have talked about in our lecture. So the first point is that the blood pH is maintained at 7.4 in spite of the daily production of large amounts of CO2 and hence protons due to our metabolism. The pH homeostasis is achieved by three systems which are interconnected with each other. So local buffers, respiratory regulation, and renal compensation. Buffers act in the order of nanoseconds. It's almost instantaneous, while the respiratory compensation occurs in seconds or minutes, while the renal compensation in hours and days. A buffer is a mixture of a weak acid and its conjugate base, such as carbonic acid, which dissociates in protons and bicarbonate. The most effective physiologic buffers have a pKa, which is near to 7.4. In case of bicarbonate, it is 6.9. The extracellular buffers are mostly bicarbonate carbon dioxide-based buffers, the ones that we've seen, carbon dioxide and water form carbonic acid, and carbonic acid dissociates in protons and bicarbonate, but also phosphate. Intracellular buffers include phosphates and proteins, such as hemoglobin, but also bicarbonate. The renal metabolism include the reabsorption of bicarbonate and the excretion of protons, both as titratable acids, especially phosphoric acids, and protonated ammonia, also known as ammonium ion. And for each proton excreted, a new bicarbonate ion is synthesized and reabsorbed. The acid-base disorders can be both metabolic and respiratory in terms of their origin. And the metabolic disorders usually involve a primary disturbance of the concentration of the bicarbonate caused by either a gain or a loss of protons. Gains of protons, fixed protons, leads to metabolic acidosis, while loss of fixed protons leads to metabolic alkalosis. And the respiratory disorders, which involve a disturbance in the partial pressure of CO2 in the blood, are usually caused by hypoventilation, so reduced respiration rate, which leads to respiratory acidosis, or increased ventilation rate, which lead to respiratory alkalosis. The compensation for the acid-base disorders can occur either at a respiratory level or at a renal level. And usually when it's metabolically induced, the respiratory compensation occurs. When it's respiratory induced, the renal compensation occurs. So when the primary disorder is of metabolic origin, the compensation is always respiratory, while when the primary disorder is respiratory, the compensation is of renal origin. So to sum up, acidosis is caused by the generation of protons or loss of base from the body, which leads to a decrease in the concentrations of bicarbonate in the blood. When the acidosis is of metabolic origin, it's compensated via respiratory compensation, known as hyperventilation. Hyperventilation leads to the decreased levels of CO2 in the blood, leading to decreased levels of protons in the blood. The cause of the respiratory acidosis is usually defective exchange of gases in the pulmonary parenchyma, especially exchanges between blood and alveoli. This leads to the decreased effectiveness of the excretion of CO2 via expiration. And usually the compensation is renal by reabsorbing higher amounts of bicarbonate. The alkalosis can be metabolic and caused by loss or generation of too many bases from the body, leading to an increasing concentration in bicarbonate in the blood. And the compensation is respiratory, so the compensation leads to hypoventilation, which leads to the increased levels of CO2 in the blood, leading to increased levels of acid, of protons in the blood, while the respiratory alkalosis is caused by hyperventilation, which leads to a loss of CO2. Hence a loss of protons from the blood, and it's compensated renally by increasing the urinary secretion of bicarbonate ions. And I am done with this series of lectures on the kidneys. I hope you enjoyed it and you didn't find it too heavy. I know I enjoyed it very much because, as I said more than once, I really love the kidneys. I'm looking forward to see you at the workshops where we are going to go through some of the concepts that we have explored during these lectures in a more applied fashion. In the meanwhile, stay safe, good luck, and if you have any questions, drop them on the Padlet. Bye-bye.